Hello, everyone. I just want to thank you all for joining us today to review the 2019 QPP Mips final rule. I really appreciate you all taking the time out of your busy day to join us. Before I jump into the details of Mips in 2019, I just wanted to let everybody know in attendance today that in the handout section of our webinar widget, you'll see that you are able to go ahead and download a PDF version of our presentation today. So go ahead and take a moment just to do that so you can follow along with me. My name is Usman. I am an account executive here at HealthMonix and primarily focus on helping practices of all shapes and sizes get started with their MIPS reporting. And joining me today is Christina Zink. She is our communication specialist, and she will be able to answer any questions submitted to us. So also in today's webinar widget, there is a tab that says questions, so you'll be able to submit them there, and Christina will go ahead and answer them as they come in. So just a bit more background about us, about HealthMonix. One of the main things we do is assist with MIPS reporting. And our registry, Mips Pro, is already open for 2019 registration. So just keep that in mind as you review the 2019 final rule with us today. Also, just wanted to share with everybody that for joining us today, you are able to take advantage of our lowest prices for the 2019 performance year. All you need to do is use the discount code webinar1218, and they'll go ahead and take, I believe, up to $50 off per provider. Also, just know that that is only going to be valid within the next couple of days. So just be sure if you are looking for help with 2019, Mips Pro is open and we can take some off the price for just as a thank you for joining us today. So now that you know a little bit about us, we do always enjoy learning some information about those joining us today. So we just have one poll for you if you don't mind answering. And we really just want to know if you all have begun your 2018 MIPS reporting yet. So if you all just don't take a mind to just state yes or no and submit that answer for us. Thank you. So I see a few more votes coming in, so I'll leave it open for the next 10 seconds or so. Great. So thanks everybody. It looks like we're pretty split on who has begun their 2018 MIPS reporting and who has not. For those of you who have already done it in today's presentations, we will be comparing and contrasting what's different, what has changed for 2019. For those who have yet to start their 2018 MIPS reporting, just know if you are eligible for this year, there is still time to complete your MIPS reporting. And if you are eligible for the first time in 2019, today's presentation will still be a great place to start and help you prepare for the 2019 MIPS performance year. So thanks everybody for answering that poll. And now that you know a bit more about HealthMonix and Mips Pro, and now that we know a bit more about who's joining us today, we can go ahead and really get started in our presentation. So what's on the agenda? First thing we're going to do is just go over the highlights. What are some of the biggest takeaways from the 2019 final rule? Then we'll go into a bit more detail of each of the MIPS performance categories, as well as review what makes up the final score and what the submission process is. And finally, even though you can go ahead and submit your questions during our presentation, we'll have an open Q&A at the end just in case anybody can benefit from some of the questions and answers provided. All right, so like I said, we're going to go ahead and review the highlights and what are some of the biggest changes in 2019. The quality category has been reduced down from 50% of the final score to 45% of the Mips final score. And in addition, clinicians can now submit a single measure via multiple collection types. Those 5 percentage points that were taken away from the quality category have now been added to the cost category of MIPS, which is 15% of the final score. As for improvement activities, the biggest change in this category is CMS went ahead and removed the promoting interoperability bonuses. Speaking of promoting interoperability, CMS is changing how they are evaluating clinicians and scoring clinicians in this category. So now clinicians must be on a 2015 certified EHR technology to even report this category of MIPS. And CMS has also instituted a new scoring methodology that is more so strictly performance based. So there are some big changes in promoting interoperability. And another really notable change is CMS has increased their performance threshold. So currently, the minimum points needed to avoid the penalty is set at 15 points. For 2019 MIPS reporting, CMS has increased it from 15 points to 30 points, and they have increased the additional performance threshold to 75 points, and scoring 75 or above puts you in the exceptional performance range. So just to state that once more, in different terms, a minimum of 30 points is needed, or else you would be subjected to a penalty in 2021. And if you really are looking to earn incentives and get the highest return on your investment for MIPS reporting, you really should aim to score 75 or above. Also in 2019, we have a number of newly eligible MIPS clinicians. So included in current eligible clinicians such as physicians, PAs, and NPs, now included are physical therapists, occupational therapists, psychologists, qualified speech language pathologists, audiologists, dietitians, and nutrition professionals. So CMS still requires physicians, PAs, and NPs to continue reporting MIPS, but now included for 2019 MIPS reporting are PTs, OTs, psychologists, speech language pathologists, audiologists, and registered dietitians and nutrition professionals. And also just keep in mind that for the newly eligible MIPS clinicians, um, for majority of categories, the requirements are still the same. So just keep that in mind as we continue on with our presentation today. There are still exemptions for MIPS. So if you are a provider who's newly enrolled in Medicare, who falls below the low volume threshold, or is enrolled in an advanced alternative payment model, you would be exempt from MIPS reporting. And also just keep in mind the low volume threshold is set for 2019 to be less than or equal to $90,000 in Medicare Part B charges, and that is Medicare Part B allowed charges. If you see less than or equal to 200 Medicare Part B patients, or provide less than or equal to 200 covered professional services, if you fall below any one of these numbers here, you are exempt from MIPS reporting. However, in 2019, there is a new opt-in option. So if you exceed one or two of these numbers here, for example, if you see just 150 Medicare Part B patients, but you're billing 100,000, you are now able to opt into Mips reporting and be eligible for the payment adjustment and incentives. So just keep that in mind. Even if you fall below the low volume threshold, you certainly still can opt into MIPS reporting and also look to earn some incentives as a result. CMS has also changed a bit MIPS virtual group reporting. So the group policies and elections are remaining the same as they have in the past, but they did go ahead and change the determination period to align with the MIPS eligibility determination period. So for 2019 MIPS reporting, CMS will review data from October 1st, 2017 through September 30th, 2018 to determine if a virtual group is eligible. And if you do wish to become a virtual group, the deadline for election is December 31st, 2018 for 2019 MIPS reporting, and you would need an elected or designated virtual group representative to email CMS at the address below by December 31st. So if you are looking to form a virtual group, just know the deadline to submit is December 31st. Now that we reviewed who's eligible and some of the biggest changes in 2019, we're going to go ahead and dive into each performance category. To begin, we're going to first focus on the quality performance category, even though this has been reduced to 45% of the final score. Still, quality is where majority of the work related to MIPS really occurs. CMS is looking for you to select 6 quality measures. Of those 6 measures, at least one must be an outcome measure. If for whatever reason you are unable to select an outcome measure, CMS will allow you to choose a high priority measure in its place. And also just know there is no limit to the number of outcome measures or high priority measures you're able to select. CMS is looking for at least one, but you can choose more to be a part of your 6 quality measures. And alternatively, you can report on a specialty specific measure set or subspecialty measure set as well. So just to compare it from last year, as mentioned earlier, it has been reduced to just 45% of the final score. Also, participants are now able to submit via multiple collection types. So you are able to report a single category of MIPS through different methods, such as a registry like MIPS Pro, for example, but also you could report directly through CMS's web interface as well, and they'll go ahead and really combine your performance from both of those methods. Additionally, policy for group reporting the CAPS for MIPS survey, if the sample size is not sufficient enough, the total available measure achievement points would be reduced by 10 points and the measure would get re-rated to 0 points. In other words, you are able to be exempt from some of the CAPS measures. Also, as for claims reporting, only small practices, which CMS defines as a group of 15 or less clinicians, is able to report via claims. In the past, individuals and groups were able to, but now it's just allowed for small practices. There are also now extremely topped out quality measures, which have really high mean performance percentile ranges. And just keep that in mind as you select your quality measures, as If one of them is going to be topped out, it's just going to be more challenging to get a perfect score out of 10 there. Also, just know in addition to needing to select 6 quality measures for this category, CMS does require you to report on 60% of all patient visits in the entire calendar year. So CMS would be looking for the quality category for a total of 60% of your patients across all payers to be reported. As for quality measures, CMS has released 10 new ones, and they actually did remove 26 quality measures from last year. So as you are selecting which ones you're going to report for 2019, just keep in mind that some of them might have been removed, but nonetheless, new measures are available for you to choose from. Next up, we have the Promoting Interoperability category of Mips. This is the second highest weighted category and worth 25% of your final score. This does just require a 90-day minimum reporting period, and CMS does require that 2015 certified EHR technologies are used in order to report this category of MIPS. In addition, they have instituted a new performance-based scoring methodology. So to compare these changes from last year, CMS allowed 2014 certified EHRs. Just know you must be on 2015 in order to even report this category. They also now, as a result of that, just have one objectives and measure set based on the year your EHR is certified. They have released 2 new measures in this category. The first is called Opioid Treatment Agreement, and the second is Curie of PDMP. And we're going to go ahead and dive into the new scoring methodology on our next slide. So it's performance-based scoring at the individual measure level. Each measure gets scored based on the MIPS eligible clinician's performance for that measure. So you would need to be documenting a numerator or denominator or yeses or nos where applicable. Scores for these individual measures get added up, and there is a total of 100 possible points that can be earned in this category. If you are concerned about that, just know if there are measures that are not applicable to you, you can be excluded from some of them, and CMS would then reallocate or reweight your score to other measures. Also, if you are a newly eligible MIPS clinician, such as a psychologist or physical therapist, for example, you are exempt from promoting interoperability. So just keep that in mind. If you're a newly eligible MIPS clinician, you are exempt from promoting interoperability. Moving on to the third category of MIPS improvement activities. This is worth 15% of your final score, and there are several hundred improvement activities for you to choose from. Each are either designated as high-weighted activities or medium-weighted activities. The high-weighted ones are worth 20 points, while the medium-weighted activities are worth just 10 points. A total of 40 points, though, are required in this category. However, if you're considered rural or an HPSA, if you're a non-patient facing clinician or small practice, which is a group with 15 or less clinicians, you would then just need a total of 20 points in this category. Also, if you are a patient-centered medical home, you automatically receive full credit for improvement activities and therefore would not need to choose any of these to attest to. You're already receiving full credit in this category. So compared to last year, there's no change in how much it is worth in your final score. However, the improvement activities inventory has been modified, and I'll get into that a bit more on the next slide. They have also changed the time frame for annual call for these activities. Also, the improvement activity nominations received in year 3, just know that they will be reviewed and considered for possible implementation in year 5. So any comments you're making on improvement activities, just know that if you're making them in 2019, if they are going to be implemented, it would not be until year 5 or 2021. And the submission time frame for these nominations is from February 1st to June 30th, 2019. So just keep that in mind if you wish to propose any changes in this category of MIPS. Also, previously, you were able to receive promoting interoperability bonuses for some of these improvement activities. CMS has unfortunately removed that. So if we look at the improvement activities inventory, they have, CMS that is, has instituted 6 new improvement activities to choose from. They edited 5 existing ones, and the participation in population health research has been removed. So to report this category, you would just need to review the updated inventory, identify improvement activities you meet, and simply complete an attestation for them. And finally, we have the cost performance category, which now accounts for 15% of the final MIPS score. This is automatically calculated from your administrative claims data. Like quality, the performance period is the entire calendar year. So CMS would be looking at data from all of 2019 in order to calculate your cost score. And benchmarks do come from the performance year. So compared to last year, as mentioned earlier, it has been increased from 10% of the final MIPS score to 15% of the MIPS final score. Last year, there were only 2 cost measures, the first being Medicare spending per beneficiary, the second, the total per capita cost. CMS, in addition to these, have now included 8 episode-based measures, which I'll get into a bit more detail on the next slide. In addition, there is now a case minimum of 10 for cost measures that are marked procedural episodes and 20 for acute inpatient medical condition episodes. So that might not make sense until you look at this slide here. So here are the 8 new episode-based cost measures. 5 of them are marked as procedural. The other 3 are marked as acute inpatient medical condition. And these 8 here are the newly instituted cost measures in addition to Medicare spending per beneficiary and total per capita cost. All right, and that really marks the end of how much we're going to dive into the requirements for each MIPS performance category. So if you have not already, if you have any questions, feel free to submit them to us and we will be sure to answer them as soon as we can. And now we're going to go ahead and just review the MIPS final score as well as submission methods. So to look at the entire composite performance score, you can see here that quality accounts for still majority of your final MIPS score. Promoting interoperability is just worth 25%. Improvement activities and costs, meanwhile, are worth 15% of your final MIPS score. Last year, CMS did give small practices a bonus. They used to give 5 additional points to your final MIPS score. They're now instead adding that just to the quality performance category, and they're going to add 6 points towards the quality performance category numerator. So it's no longer being applied to the final score. Instead, they would just apply the bonus to the quality category. And just as a reminder, CMS considers small practices any group with 15 or less clinicians. There are also changes to the Mips final score. A weight of 0% will be assigned to each of the 4 performance categories, and a final score equal to the performance threshold when a Mips eligible clinician joins an existing practice in the final 3 months of the year, and that group has not already been reporting Mips as a group, or when the Mips eligible clinician joins a newly formed practice in the final 3 months of the year. In other words, if you are a Mips eligible clinician who joins an existing practice in the last 3 months of the year, and that practice is not reporting Mips as a group, CMS will exempt you from Mips reporting that year, or if you are an eligible clinician who joins a new practice in the last 3 months of the performance year, CMS will also allow you to be exempted from Mips reporting. And in 2019, the transition year pacing options have changed as well. The minimum has been increased from 15 points to a total of 30 points. Failing to reach 30 points would result in an automatic negative 7% payment adjustment or 7% penalty on your Medicare Part B reimbursements. Scores above 30 and up to 74 points, in addition to successfully avoiding the penalty, are able to look to earn some incentives. However, it's not until you fall in this exceptional performance range, which is now from 75 to 100 points, where you can really look to maximize your incentives. So I know here, CMS is promising up to 7% in incentives with additional bonuses on top of that. Um, for those who have reported in 2017, you know that the percentages, at least so far, are a bit smaller than that. Nonetheless, if you are really looking to maximize your return on investments, you really do want to fall in this exceptional performance range. And as you can see, with each year of the program, the payment adjustments and the penalties are only increasing year by year, and they do take into effect 2 years after the MIPS performance year. Also, just keep in mind that the MIPS payment adjustment does follow the provider, the NPI from practice to practice. Also note that your MIPS performance, your MIPS scores will be posted online on Physician Compare for the public to view. So just keep that in mind with your MIPS reporting, that payment adjustments will follow the provider, but nonetheless, these scores do get posted online for the public to view. And if you really are looking to maximize your return on investment this year, you should aim to at least get a score of 75. Closest to 100 is best. And if you just want to avoid the penalty, you would need to ensure a score of at least 30 points. And of course, if you need any help with that, as mentioned earlier, MIPS Pro is open for 2019 registration already. And for those who are looking to get started, you can with the discount code webinar1218, and that does expire, I believe, within 48 hours. So just be sure, if you're interested, we're here, we're available to help. If you have any questions, you can call us directly about MIPS Pro or submit questions here. And that marks the end of our presentation. So I do just want to thank everybody for joining us today. And like I said, we are taking questions and reading answers out loud. So I'll allow everybody still in attendance to submit their questions to us, and we'll go ahead and start reading some of the answers in about 5 minutes. So just want to thank everybody once more for taking the time out of their days to join us to review MIPS reporting in 2019, and we'll get to answering some questions aloud momentarily. Thanks. All right, so we're going to go ahead and start reading some of these questions and answers out loud as it might apply to others still in attendance with us. First, will we receive this recording afterwards? So yes, today's presentation is being recorded and we will be sending everybody who attended and everybody who registered a follow-up correspondence, and included in that will be today's handouts as well as a recording of this presentation. So if you are afraid you didn't take all the notes you might have needed to, or if you want to share this internally, you certainly will be able to do so. We have another great question. Are the quality measures that have been added or taken away already posted on the QPP site? So unfortunately, QPP CMS has yet to put that information in an easy to view page on their website. However, in our blog, the Health Monix blog, we do have a list of the removed and newly added quality measures. So if anybody does need that information, you can visit the Health Monix blog. Sometimes it also gets referred to as the Health Monix Advisor or newsletter. So that information is available on our website. We have another question. However, this one is related to 2018 reporting. However, it does apply to any year. If a group is reporting all of its physicians each via claim submission, does each physician need to report IA, or can IA be, and of course IA is improvement activities, can improvement activities be reported for the group just once to cover all of the physicians in the group? So if you're reporting as an individual, you wouldn't be able to report other categories of MIPS as a group. You would need to choose individual reporting or group reporting across the board for each performance category. So the answer to that question is no. However, it is likely, though, that your quality submission alone would be sufficient to avoid the penalty in 2018. But if you wanted to look to get some incentives, you wouldn't be able to do quality as individuals and improvement activities as a group. We have another great question in regards to reporting if we changed EMR during the reporting year. So if you are submitting MIPS outside of your EMR, whether it be through MIPS Pro, CMS's web interface, or claims, for example, it really ultimately would not affect your MIPS reporting. However, if you are submitting through your EMR, this might cause some complication. If that is the case, I would recommend you connect with your EMR to see what their solution is, or contact the QPP help desk. I will state though that MIPS Pro has supported a number of users who have switched their EMR and have compiled reports from various systems. So just keep that in mind if you are going through an EMR transition. We have another great question about 2019 measures. Do you have a list posted for suggested 2019 quality measures by specialty? So unfortunately, we do not have this list yet. We will start compiling our recommended measures once the specifications are released by CMS for 2019. However, that would likely become available in mid-February. However, we on our website, we do have recommended quality measures for each specialty with 2018 data. So that still is a helpful page to visit as you prepare for your 2019 MIPS reporting. And if anybody wishes that link be sent to them, we certainly can. We have a question now about the cost category. What happens if you do not have any of those factors under the cost slide reporting? How would you end up reporting this? Well, if that is the case, you would be exempt from the cost category, and your score, those 15 points would then be reweighted back to the quality category. So if you are exempt from cost, it will all go to quality. We now have a question about reporting through CMS's web interface. Are all of these changes the same for those who report through CMS's web interface? If that is how you're reporting MIPS, the measures are different through that method. However, a lot of these changes do still apply. We have a great question about where to attest to improvement activities. So there are a couple of ways you can do that. MIPS Pro does allow for improvement activities attestation. If you wish to report through a different method, though, some EHRs allow for this as well as um, CMS's web interface, and that can be done through your EIDM account. We have a question about EHR reporting now. Do you know if the EHR reporting will open back up for submitting data? If so, where do you go to register for that? That's going to vary by your EHR vendor. So if that is how you plan to submit, I would recommend contacting them directly. Unfortunately, we wouldn't be able to assist with that. However, MIPS Pro is already open for 2019 registration. So just keep that in mind as you're looking for a solution to report and submit your reporting. So we have another question related to promoting interoperability. And just to restate it, a 2015 certified EHR technology is required to even report the promoting interoperability category of MIPS. And staying on top of PI, promoting interoperability, if you are a small practice, you would not need to file an exemption. Being a small practice doesn't automatically make you exempt from promoting interoperability. Rather, certain clinician types are exempt, or if your EHR becomes decertified during the year. So you can contact CMS directly to see if there's a way you can get an exemption, but typically that is just for certain clinician types. We have a question now about utilizing Healthmonics and our registry MIPS Pro. Is there a due date for getting all of the data to you? So no matter what the reporting year is, we do ask for data to be completed by February 15th following the performance year to ensure that there's enough time to that we're validating everything and to ensure that you are hitting at least CMS's minimum requirements. However, we normally do accept submission and data after that date. However, the longer you wait, the less thoroughly we are able to check it and confirm successful submission. So just keep that in mind. We have a question now related to opting in. We are a newly qualified practice with only one clinical psychologist with less than 200 clients. We are exempt, but could we seek out incentive pay? So yes, if you are in that case then billing more than $90,000 to Medicare as a group, then you are certainly able to opt into MIPS reporting and therefore be eligible for incentives. So we now have a question about quality reporting. Can you go into further detail around the 60% of patients required to report quality? Is this gap of 40% given for a reason? So CMS has stated they're working to ramp up the total percentage of patients required to be reported to 90%. However, they have delayed that due to a lot of feedback they've received, and this gap is simply provided to give people some room for error. We now have a question about group reporting versus individual reporting. In the example this attendee gave, in their practice, they have one provider who is eligible, one who is not. However, they're curious if it's worth reporting as a group based on what the payment adjustments would look like. So if you are reporting Mips as a group, any sort of payment adjustment, any sort of incentive would be applied to the entire group for successful Mips reporting, whereas if you're just doing it individually, that individual clinician would be eligible for the incentive. So we do typically encourage group reporting, and part of the reason is in order to get a larger incentive that benefits each one of your providers and therefore the entire practice at large. So that's a great question. If you are a new um, eligible clinician, does the improvement bonus apply to you? That was another question that was asked. So the improvement scoring bonus would not apply to anybody reporting Mips for the first time. However, newly eligible clinicians are still able to report the improvement activities category. Just to restate, only newly eligible clinicians are exempt from the promoting interoperability category. However, these newly eligible clinicians can still report quality and improvement activities. We have another question in regard to 2019, specifically for reporting for physical therapists and occupational therapists. If they are not treating in a clinical setting but an outpatient service, would this still fall in line with the quality measures? Um, So for that question, I would recommend just contacting us directly and we'll be able to speak more to that. So that's a really great question and we're happy to talk that a bit further in more detail. Also, if you are curious if you're exempt from any categories of MIPS or if you just want to check your eligibility status, at the qpp.cms.gov website, they do have a participation lookup tool that can be accessed from the top right of that page. There, you're able to enter any provider's NPI number and for now get a breakdown of their eligibility status for up to 2018 Mips reporting. However, it is loaded with information and is still useful for you to assess 2019 eligibility. All right, and so we have about 10 minutes left in our presentation today. I see there are some questions that have yet to be answered. We'll certainly be getting to those. Also, if anybody has any additional questions, please go ahead and submit them to us, or you can send us an email at webinars@healthmonics.com. Also, just as a reminder again, if you are looking to utilize a registry like Mips Pro, we do have a discount for 2019 reporting options. Just be sure to use the code webinar1218. You can visit us at mipspro.com. And if you have any questions for us, we're more than happy to talk through these reporting requirements in more detail, as well as our registry Mips Pro. And like I said, please continue submitting your questions and we'll be getting to them. Thanks. All right, so we got another question that I think's really going to be relevant to everybody still in attendance. If a practice only focuses on the quality category and receives 100% for reporting there, would that be enough to avoid the penalty? So yes, so if you're reporting quality and have at least 6 measures and one's an outcome or a high priority measure and you're reporting on at least 60% of your patient visits in the calendar year, you are able to, if you do well, get 100% in that category, and that would result in a final MIPS score of 45. So that is one way to go about avoiding the penalty. So certainly, yes, absolutely, you can avoid the penalty by getting a perfect score in quality. And we have a couple more minutes left, so if any more questions come up, ask away. All right. As we're about to sign off, we got one last question. For new providers, is the $90,000 across the whole practice or just that provider in order to get the incentive? So if you're reporting as an individual, the 90,000 would just pertain to the individual clinician. If you are reporting as a group, it would pertain to the entire practice. Also, if we have 3 providers in a group, but only 2 are eligible, you still would be reporting on behalf of all 3 providers. So if you're reporting MIPS as a group, those who would individually be exempt would still become eligible underneath the group. All right, and unfortunately, that's the end of our time today. However, we're more than happy to answer any additional questions any of you might have. You can email us at webinars@healthmonics.com. You can also call us directly. On this page, you're able to see our website, mipspro.com. We have tons of great free resources there, as well as information on our registry, Mips Pro. If you're looking for help with 2019, we're open for registration. Just be sure to use the discount code webinar1218. So just want to thank everybody once more for joining us today. Really appreciate all of your time to learn more about MIPS reporting in 2019. And I hope to speak with all of you again. Thank you.